There are many YouTubes discussing the topic of how long does a dental implant last. But the reason that you've come to this educational platform is to learn about the critical information that no one else is sharing with you as a patient and is vital so that you can make the correct decision based on your best interest at heart. I'm an implantologist with 30 years of clinical experience, and I've placed and restored 16,000 implants. Our goal is to discern the truth from media hype and present you with scientifically backed information. Your time is precious and your health is invaluable. Thank you for investing your time with us. When we refer to the lifespan of a dental implant, we need to realize and understand that most dental implants comprise of three main parts. The implant body, which is fitted into human bone. This would be an example, obviously a scaled up version. And then an abutment, which is the connection that is fitted onto the implant. And finally, the superstructure, which is placed on top of this. For example, a denture or a crown or a bridge. We refer to these three entities, the implant and the abutment and the superstructure, as an implant system. Now let's discuss these. The actual dental implant bodies are designed to be permanent and durable and can last decades or even a lifetime with proper care. By way of example, my father lost his 4 lower front teeth due to a motor vehicle collision in 1989 when I was still at university and unable to help him. He was initially fitted with a partial denture, and then in 1996 he reported to me that he was tired of wearing a partial denture, and we restored that area with 2 implants supported by a 4-unit bridge. In jargon, we refer to that as a 4-on-2. And that work is still stable and in his mouth after 27 years. We refer to this as a stable implant system. The longevity of an implant system depends on many factors like oral hygiene, overall patient health, and the quality of the materials that the entire implant system is utilizing. We will dive into this topic much deeper and give you the crucial good oral hygiene protocols reduce the bacterial load in your mouth, and specifically it disrupts the adherence and attachment of these bacteria onto the hard and soft tissues in the mouth. And simply put, if there are less bacteria in the mouth and those bacteria are floating around in the mouth versus being attached, they can cause less problems. We will discuss this more in depth in episodes 37 and 41 of the Patient Education series. Uncontrolled diabetes and immune disorders essentially hinder the body's ability to combat infection, and this can make implants susceptible to infections. By way of example, I had a male patient in his 60s who had a stable implant system for 20 years, and all of a sudden he presented at my surgery with rapid weight loss and soft tissue infections around his implants. And once we had investigated a little deeper, he had unfortunately manifested late onset diabetes. We refer to this as type 2 diabetes. So once this had been correctly managed, the problems in the mouth settled down. Just like all consumer goods, tires, cars, light bulbs, there is wear and tear. And so therefore, logically, the superstructures on implant systems, that being dentures or crowns attached to the implants, may require replacement and repair over time. One of the paramount factors that no one discusses is that original and genuine factory-made high-quality components need to be used in the abutment systems. I wrote and published my thesis specifically on this topic. In dental implantology, we work to very high accuracy levels. More specifically, we work in microns. There are 1,000 microns in just 1 millimeter. If the male and female abutment components in an implant system have a maximum discrepancy or tolerance of between 3 and 5 microns, like you will find in genuine, high-quality, original, factory-made components, then when these components are placed in the human mouth, where they are subjected to very high forces coming from all different directions, when we chew and when we subject these components to thousands of chewing cycles as the years unfold, then the likelihood of these system components remaining stable in the patient's mouth is very high. Whereas if non-genuine components are utilized, they will not have the same degree of accuracy and fit, and the likelihood of there being complications in the long term is significant. And experienced clinicians will see this, unfortunately, all too often. It is vital to realize and understand that because implants are fitted into bone, that the overlying soft tissues, and by that we mean the patient's gum in plain language. The patient's gums are what keep the bone and the implants healthy, because they stop bacteria in the mouth coming into contact with the bone, and therefore anything that causes damage to the human gum or results in the human gum not functioning properly may result in problems with the jawbone. And obviously with the implants in that jawbone, this is the same principle as with gum disease, where we use a fancy term called periodontitis. In simpler terms, periodontitis is a severe gum infection that can cause harm to your teeth and your gums, causing them to become weak and loose. If left untreated, it can even lead to loss of all the teeth. Good oral hygiene practices, including brushing and interdental brushing, and here is an example of an interdental brush, is essential for implant longevity. Please do not use dental floss around implants, as there are a number of technical problems with this. One of the problems is that floss can cause separation between the gum and the neck of the implant. And obviously, if there is separation at this critical point, then bacteria can get into this area, and potentially this can create problems long term. Regular dental visits will monitor and maintain dental implant health. Avoiding habits like smoking can negatively impact the lifespan of dental implants. I always joke with patients and say to them that I'm too old to lecture to you about smoking, and you're too old to receive a lecture. But the reality, in simple terms, is that smoking harms the gums by causing inflammation, by reducing blood flow, and weakening the body's ability to fight infection. This can lead to gum disease and potentially tooth and implant loss if not addressed promptly. The reality is that there are many patients that smoke, but these patients know, understand, and realize that this may affect the lifespan of their implants and their financial investment in their implants. I placed an implant into one of my daughters who had a congenitally missing canine, and this was a stable implant system for many years. She had to emigrate and she began smoking, and we were unable to do the regular dental visits. The short version is that she lost the implant, and we had to redo this work years later. The final point I would like to share with you is that there are ample scientific evidence proving that good oral hygiene with a full set of teeth in old age is associated with a higher likelihood of reaching the age of 100. Losing multiple teeth by age 65 can increase your risk of heart disease, diabetes, and osteoporosis, impacting lifespan negatively. It is a wise decision that if you are over the age of 65 and you have lost multiple teeth, you have lost all your teeth, that you replace these missing teeth. If you have a full denture, then consider securing that denture with some implants, because it will allow you to correctly masticate and eat more broadly. You'll be able to eat healthier foods that require obviously more chewing. Your digestive system will be able to absorb those nutrients, and you will be able to socialize normally without the fear and embarrassment of your denture falling out. And ultimately, you will be able to enjoy a better quality of life. We will elaborate on these topics even further in episodes 11, 37, and 41 of the Patient Education series. If you find the content of this video valuable, we encourage you to like and subscribe to help us expand this educational platform. Remember that the path to good health lies in evidence-based scientific research. Stay tuned to our next podcast, where we will dive into the topic, are dental implants safe, and provide you with the valuable insights.